I get to watch students from the very beginning, like really kind of doubt their capacity to feel anything. And everybody feels something. Everybody like surprises themselves as they go through of like, wow, like I can actually feel something and learn something and feel like I'm making a difference as I'm cultivating these skills. So it absolutely doesn't require any experience or even any know-how, but just an interest to cultivate this healing power within you to be able to offer and really like be present, like practice presence with another human being and to tune into that energetic field. In this program, we look at medicinal Taoism in the sense of kind of what allows our healing to unfold in a really like natural, resistance free way, and how do we support our patients and ourselves to align with nature and align with the simplicity of the order of things, and to come back into a state of like think about our nervous system, like a state where our nervous system can relax and open, or that our minds can be like open to the possibility of healing and doesn't get so caught up in like a disease process and a diagnosis, but allow this sort of opening and this capacity to connect to bigger universal truths. This program is designed as a 6-weekend module program, and it's designed to go through all 6 somewhat in order, ideally in order. And what's most important is to complete modules 4, 5, and 6 in order. So there's a little flexibility in the beginning. But the first 2 modules are really learning the sort of history and practice of Qigong. We do Qigong movement, we do self-cultivation, boundary practice, we do really diving into Taoist theory, into Taoist meditation, like the more on the self-cultivation pieces. And we start into the energetic sensing and diagnosis, and a little bit with medical Qigong protocols, although that comes a bit later in the program because we're developing the sort of the basis or the foundation within ourselves and within our skill set, our skills being many things we do with our hands, our breath, our body. Sort of the self-cultivation piece is Taoist medicine and like Chinese medicine, psychological, spiritual piece, and then this medical Qigong protocol piece of really learning these tools to be able to offer and be a trained and certified medical Qigong practitioner, sort of where the goal is. But again and again, I just find this, it's really a personal journey also, like really a personal journey to get to know your own energetic system and come into your own sort of authority and confidence and agency as a healer, whether or not people ever thought they could be a healer or not. And again, whatever your background is, I've watched people kind of develop and grow in that way. Medical Qigong uses all of the understanding of all the 5 organs. We in this program, we go into the depths of the 5 organs, both physiologically, energetically, but also psycho-spiritually and emotionally, and the spiritual dimensions and aspects of the organs as we work through the energetic balancing of those organs. And so medical Qigong has a diagnosis system. We learned 3 different diagnosis systems in this program. It's based in the theory and practices of the acupuncture meridians and points. We use acupressure points. And then we also use the theory and foundation of the organs, the generation cycle, the control cycle, like all of that sort of foundational stuff that you learn in school really gets applied and brought to life in a different energetic way when we're practicing medical Qigong therapy. So Taoist meditation and Qigong meditation is a big part of this program also, and a big part of the cultivation, the self cultivation aspect of what is in my opinion, is so beautiful and precious to learn, but also really essential as a practitioner to be able to really deepen in your own energetic awareness and understanding, so that when you're working with a patient and working in healing, you know what your energy is like, you know your boundaries, you know how to assess and learn about energetic shifts and changes within yourself, but primarily within the patient, to be able to attune and help them come into that balance.